Welcome. On behalf of the Northern Virginia Economic Development Alliance, I want to welcome everyone to this installment of our 12-part series, Beyond COVID-19, NOVA Business Resiliency Webinars. My name is Chris Bruno, and I am the Director of Economic Development for the City of Fairfax, Virginia. The NOVA EDA, comprised of 10 founding jurisdictions, aims to promote Northern Virginia as the best place to start, grow, and locate a business in the United States. While we feel that our region is truly the best place for business, we also realize that there exists an enormous amount of uncertainty in our region directly caused by the COVID-19 pandemic. Today's conversation aims to answer just a few of the many questions that business owners and members of our community are asking during this unusual time. Businesses, governments, and consumers are all wrestling with sudden rules, new social distancing restrictions, and complicated phased reopenings. Businesses are feeling pressure to make ends meet while also protecting the health and safety of their guests and employees. The ongoing tension between preserving the bottom line and fulfilling the responsibility of preventing the spread of the virus has pushed business owners to think outside the box, creating new and innovative operational strategies. Throughout all of this, our local governments have pivoted to develop new programs and ease regulatory requirements to help businesses open safely and responsibly while welcoming back employees, customers, and visitors. Now, collectively, government, business, and the community at large are beginning to work together to develop plans to bring people back to work. What does this look like in our COVID-19 world? Today's panel hopes to discuss just that. To moderate this discussion, I would like to introduce John Jacobs. John will also introduce our panelists. Again, on behalf of the NOVA EDA, welcome to the new normal, getting back to work safely. I am very much looking forward to today's conversation. John?
Great. Hi, everyone. Thank you, Chris. Thanks very much. We have an outstanding panel today, folks. This is the 8th in our series of 12 episodes, and I'll take you through a bit of an agenda. Let me just share my screen for just a moment. And today we're going to have some videos, brief but impactful ones. So you'll quickly see the limitations of my technical capabilities as I meander around. So just give me one moment. And this takes a little second for our Zoom friends to catch up to show mode. So let's go ahead and just go through that. So yes, this is Beyond COVID-19 Business Resiliency webinar series from the NOVA Economic Development Alliance. This topic today is new normal, getting back to work safely. You just heard from Chris Bruno, Director of Economic Development with the office in Fairfax City. And I will do, as I do every one of these episodes, I'll take us through a bit of an update over the last couple of weeks. I will tell you that we are taking questions. And so at the bottom of your screen, you'll see a nav bar. If you mouse down, you can load questions there. Please feel free to do so as we go through the webinar. And additionally, in a few moments, I'll activate a poll, which is a live poll just for this audience. And we'll use the results of that poll as part of our Q&A, part of our panel discussion. There are 5 questions. They're very brief. And so I really would encourage you to please take a few moments and complete those questions. Here we go. I'll just take us right now through this update as of this morning. Some top line stats. The PPP loan deadline, as I've mentioned before, has been extended from June 30th to August 8th, which means there are 16 days remaining to apply for the PPP loans. As you know, the loans were loosened, the rules were loosened in the conversion from loan to grant back in June, so that there is now a 24-week repayment period versus 8-week, and a 60% usage toward payroll versus the original 75%. There's also a good tool, actually. The American Institute of Certified Public Accountants has created this link, pppforgivenesstool.com. And you might want to look at that because it helps speed the processing to request the conversion to a grant from a loan. Unemployment filings for the week ending the 18th of July, 1.4 million. This was reported this morning. The unemployment rate, as I reported last time, did drop in June to 11.14, holding steady through the week of the 18th. The $600 per week unemployment supplement will end at the end of this month. And if you turn on the TV, you know, pending legislation is being discussed with the administration and Congress currently. Second quarter update on forecast. The latest one that I have reliably gotten my hands on was reflecting a 2Q drop of 35.2 on GDP. The official Department of Commerce results will be out on the 30th of this month for the second quarter. Total coronavirus or COVID cases as of this morning, according to Johns Hopkins University, worldwide 15.2. That's an increase of 3.3 million over the last 2 weeks. US cases 3.97 million, which is an increase of just under a million in 2 weeks. US deaths stand at 143,204, which is an increase of 10,895 over that same period. I put this last one in here because I think it's germane to today's conversation about getting back to work safely. This is a stat that it was Yelp's analysis using their database and reported by Forbes yesterday. 55% of temporarily closed businesses are now permanently closed. It was not clear on the date range there, but if you want to look it up, there's an article that was written just yesterday. 24% of businesses that closed in April have reopened. Restaurants are the most impacted business sector with more than 26,000 closures, followed by retail overall. I mentioned earlier we have a wonderful panel. I'll just go ahead and introduce them. We have Chris Revere, Gene Wiseman, and John Kryn. I'm going to take us off of the screen share because we have the actual live people on this webinar. So let me just make a quick introduction here. Chris Revere is Deputy Director for Innovation and Planning at the Fairfax County Health Department. Chris provides oversight, leadership, and direction for the Office of Innovation and the Division of Community Health Development. His priorities include policy alignment, funding, public health information, programs, and practices that address the public health needs of all Fairfax County. Gene Wiseman is a Vice President of Architecture, Inc. in Reston, Virginia, and is known for his innovative design and style and vision. With over 24 years of experience at Architecture, Inc., Gene has established himself as one of the leaders of the hospitality and commercial practices within that firm, proven ability to deliver projects on time within budgets, and a reputation for intelligent design. So we're grateful to have Gene on as well. And John Kryn. John Kryn is chef owner of Clarity Restaurant in Vienna, Virginia. John is the only chef in the Northern Virginia, DC, and Maryland area to have garnered three-star Washington Post reviews for the restaurants he's either led and or owned. And so we're really happy to have him on board. John trained in Washington, DC, in France and New York. And interestingly, I became aware of John through some articles about his innovative approach to reopening. And we're going to hear more from John on that when we get started with the webinar. Now, before I go on, I'm going to activate the poll because I told myself I was going to do it. And you guys were going to remind me, and you've been very quiet. So just bear with me one sec, folks. I'm going to activate that poll. Here we are. It's under poll and launching it now. So hopefully everybody, you can see this poll. 5 questions, very brief. So please do try to jump in and just provide those responses. We'll review those results as we go through the webinar. First question is, I'm going to sort of try to torture Chris Revere a little bit at first here. And in your role with the Department of Health, the Health Department, Fairfax County, can you sort of summarize the key guidelines and the rules that the county is following and enforcing to help people get back to work safely?
Sure. Thank you, John, and good to be with you and our panelists and everybody who's tuning in. You know, I want to emphasize that enforcement is a very strong word. And even though that is a function of the health department, in these uncertain times, really collaboration is the term that we're using. We want to be partners with our business community. We know that there's just a ton of information that's already out there. We know a lot of information changes almost daily. And we know that folks, as I said at the top of this hour, are scrambling. So we want to work with you. We don't want to necessarily have to, enforce any rules or regulations. If we can just have a conversation, educate you a little bit, help you be creative in your workplace, and most importantly, create a safe environment. So there's a few things to keep in mind. First is, risk in the workplace depends in large part on what's happening in our community. Are people doing what is necessary to protect themselves and others from the virus? The other thing I want you to keep in mind is that modifications of the workplace can significantly increase safety, but there's no such thing as risk-free. We're trying to minimize the risk, keep it as low as possible. And no single action that you take is going to be sufficient. We recommend what we call a layered approach as being most effective. And in taking a layered approach, there's a couple things that I just want to point out. First and foremost, educate, train, and continually remind all employees and customers about the importance of knowing about the virus, how it's transmitted, the symptoms of COVID-19, and how they can minimize the risk of catching it or spreading it. And you can do that very easy by posting signs, by sending daily emails to your employees, your customers, putting messages on your website, phone messages, or any interactions that you have over the course of a day. You've been hearing for quite some time from the health department emphasis on hygiene, that we wash our hands frequently for at least 20 seconds, that we don't touch our eyes, our mouths, our noses, that we cough or sneeze into our elbow. We've talked about the importance of keeping a physical distance of at least 6 feet and wearing a face covering. Studies are now showing that face coverings do work. They are effective in reducing the spread of the virus, particularly from the wearer of the face covering to others. And that's really important if a person doesn't realize that they have the virus because they're not showing any symptoms. We want to make sure that you're cleaning and disinfecting your high touch areas frequently. For your employees, please tell them to stay home if they're not feeling well, to monitor their symptoms and to call a medical professional if their symptoms worsen. And then lastly, if anybody gets sick while they're at work, please have them notify their supervisor and have them sent home immediately. If we take these very simple steps in our daily lives and in our workplaces, we'll go a long way to containing the spread of COVID-19 in our community.
You know, I'm curious about questions that you get or the Department of Health gets from citizens and business owners. Are there a few key concern areas about safety and with regard either to returning to an office or going out to dine? I'm curious about that.
Sure, sure. Well, you know, we do get a lot of folks calling in complaints about businesses not following the statewide, at least in their minds, not following the statewide reopening requirements or the face covering mandate that we have here in the Commonwealth of Virginia. And, you know, due to the nature of the complaint, we'll either follow up directly with the business, and again, in a way that's educational, that's collaborative. You know, we're not going to immediately, you know, send our staff or, you know, folks to the location unless it's something really egregious. Or if we've received multiple complaints and concerns from customers. There are other regulatory bodies that are also part of this network of enforcement, whether it's the Virginia Department of Health or OSHA, if it's complaint that we receive from an employee who may feel that their workplace is not compliant or safe enough for them to be in. So business owners really need to take seriously, you know, the nature of the disease, the nature of these requirements. They need to know that if there is repeated violations, it could lead to a suspension of their permit to operate, fines or other serious consequences. And John, you touched on another important question that we get asked very frequently. And that's around policies for returning to work. And like the CDC, the Centers for Disease Control and Prevention, we emphasize that employers use a symptoms-based strategy as opposed to requiring one or more negative tests as a condition of their employees returning to work. If we've been reading in the news lately, we know that the time it takes for test results to come back in is growing rapidly because of the outbreaks across the country. The more time that it takes for the health department or a medical provider to receive the test results, the more difficult it is to conduct our case and contact investigation as quickly as we need to. And it also delays individuals from taking cautionary measures so that they're not out in the community or around their household, possibly infecting others. So what we mean by a symptoms-based strategy is pretty simple, that before a person returns to work, they've had at least 10 days since the symptoms first appeared, that there's been at least 24 hours since their last fever without the use of any kind of fever-reducing medication, and that their symptoms, whether it's the cough, the shortness of breath, the chills, have improved. At that point in time, the health department is going to send a notification to the employee that they have successfully cleared the hurdle, that they can come out of isolation or quarantine. And this notification can be given to the employer as sort of an official discharge, and that they can return to work. We recommend that business owners not ask for an additional letter. We believe that this notification, which is official, is sufficient, and that once presented to the employee should be allowed to come back into the business and join their colleagues back at work.
And so that employee in this example goes online and then asks for this clearance, this certification. Can you just go through that a little bit?
Yeah, sure, John. Happy to. So, when the health department receives indication of a positive COVID test, we perform an interview with that individual immediately. We assess their own personal living conditions and their ability to isolate themselves from others in their house. And we also ask them what individuals they have been in contact with over the previous 14 days. And then we get in touch with those folks too. And in some cases, depending on the duration and the nature of the contact, we may recommend that they quarantine themselves for 14 days as well. We monitor all of those individuals in our database. And we send them daily alerts asking them how their symptoms are, if they're progressing, if they're stable, if they're starting to see some of their symptoms subside. And we're tracking from the point that we believe they were infected with the disease over that period of time, and monitoring their systems, where once we become confident that they've successfully made it through their isolation or quarantine period, we will automatically via text or email send them the notification that they have completed their isolation and quarantine period and have sort of been officially discharged, which means they can go back to work, they can go back out in the community, obviously doing the protective behaviors that we've recommended. But they'll get that notification automatically. They can print it off, or they can show it to their employer on their phone. And that should be sufficient, quote unquote, proof that the health department has said they can come back to work.
Excellent. And you had provided me, I'm going to show everybody in the audience, you had provided some contact information here. Just one sec. Let me see if I can find where I was here. Right. So this you provided me. These are 3 websites and sources of information: the Center for Disease Control and Prevention, and that's a very long link. So if you have a camera, take a picture. Virginia Department of Health, and of course Fairfax County Government, and as all sources of information. So that's great. And I think I think it's interesting to watch as the pandemic continues, how quickly governments are reacting and interacting. And I think it's a great sign of coordination and hope that we can get our arms around this. Hope not being a strategy, however, Gene Wiseman, who is with Architecture Inc. and therefore is an architect, Gene, your organization had prepared a great little video around the, why don't you describe it, and I'm going to tee it up. So Gene, why don't you go ahead and describe that video, would you?
Sure. Well, thanks, John, for having me. I appreciate being here, talking to everybody. So we did a video. We recently renovated and expanded our offices. And as COVID kind of erupted, we looked at what we did and we tried to pull almost a lessons learned for other folks to show what can be done in a typical office environment in terms of the CDC recommendations, in terms of social distancing and whatnot. So we prepared a simple how-to video.
Great. So I'm going to, folks, going to share that. And I'm using the old school method of moving the mic closer to the speaker. So watch carefully. And hopefully you'll be able to hear this video.
Returning to the workplace needs to be a careful transition with smart design. We've recently renovated and expanded our studios here at Architecture Incorporated, and would like to share some of the strategies we've implemented. Circulation will be an important factor in social distancing. We've implemented a strategy of one-way pathways using arrows as well as markers to indicate 6-foot distances to maintain social distancing. We think each of these is going to be a critical component of how people move about the office on a daily basis. Social distancing impacts more than just circulation, it also impacts collaboration. We're going to see a big change in how conferences and meetings occur. Obviously with telecommuting and teleconferencing and video conferencing, things are changing already, but nothing takes the place of in-person one-on-one meetings. I think we'll see a spread of furniture, chairs further apart, less people in these meetings. Collaboration spaces can still be utilized provided that we maintain social distancing. To that effect, there may be less chairs, fewer people, and privacy screens separating individuals and still make these spaces functional. The important thing to remember is staff needs to feel safe at work. So having a variety of different size spaces that allow for different numbers of people to meet and still feel separated, that's the most important part of all of this. Take advantage of outdoor space whenever possible, whether it be ground floor outdoor patio space or upper floor balconies. Our office incorporates operable storefront, which allows us to open up our pantry and common area to the outdoors. But this is another method to expand our footprint and keep people further apart from each other. In addition to collaborative spaces, personal workstations play an important role in how people feel at the office. Our office was designed with a variety of workstation types that include private offices, private workstations, and shared open offices. Even in an open office work environment, simple changes can be made to maintain the required distances between staff. Permanent construction, such as knee walls or systems furniture partitions, should separate staff from circulation passageways. High-density areas such as workstation clusters or bench-type seating need privacy screens where social distancing is not possible. At the end of the day, the most important takeaway is for staff to feel safe and secure in the office. If you need help reconfiguring your space, please contact us.
That was great. Thank you, Gene, for that. I'm going to go ahead and stop sharing my screen for a moment and put my mic back where it belongs. That was great. And I liked very much the variety of scenarios that you went through in an office space. And we'll hear more about the restaurant space in a moment. But when you think about your clients, what are you hearing from them when it comes to redesign? Are they implementing these changes, or are there budgetary issues, or where do they stand?
Absolutely. I mean, unfortunately, we're seeing the full spectrum right now. You know, we work in multiple market sectors. So we've seen groups like some of the tech companies, they've just abandoned ship and said, we're not coming back until 2021. Those type of companies can successfully remote work very easily. You know, others just can't do that. So what I think you're going to see is kind of a hybrid solution where a lot of the inexpensive, simple changes that I illustrated in that video, you know, decals, floor markers, mostly operational changes. I think you're going to see a lot of that. And I think that works well. I think the next 6 months, the economy is going to drive a lot of this in terms of what happens. You're going to see commercial spaces. They're going to have to decide whether they're going to expand or contract. You know, some folks have to expand to accommodate more space to get the same number of people doing the work. Others may contract and say that we're going to do a hybrid model and we're going to have half the people remote work half the time and half be in the office. So you may have contraction. So I think the commercial office market is going to change quite a bit. On the other markets, I think retail and hospitality, I mean, there was no decision. You're either open or you're closed. If you're open, you're figuring out a way to adapt. And I think we'll talk about quite a few of those methodologies today.
Yeah, great. And I think what I'm going to do is go right to you. You gave me 2 slides that I think are quite compelling. So I'm going to try to share my screen again. Let me just get going here. 1 second, folks. And just a moment, please. So you provided 2 slides. One is redesigning an office space and the other a restaurant space. And this is not the clearest, but Gene, can you take us through what these are?
Sure. The plan on the left, so this is just a hypothetical, it's what we call a test fit, where we do some space planning. The plan on the left, we actually did back in early March before COVID really had any implications. The plan on the right, we kind of re-looked at it post-COVID. And part of this was kind of an analysis to see what would happen to kind of a generic office tenant. So the plan on the left, you can see around the perimeter, there are what are called benching stations. Those are kind of parallel workstations where people are very, very well packed in. Design had been going that way for quite some time, cutting down the square footage of an office per person and giving more lounge space, more pantry space, more meeting space. But obviously with COVID and social distancing, those things don't work as well. So the plan on the right, you can see they've gone back to more of the traditional cubicle, where there could be a cubicle partition or some sort of divider where you're not making the square footage jump exponentially, but you're still maintaining that social distancing. In addition, we've overlaid kind of the 6-foot social distance circles in some of the collaboration spaces, the meeting spaces, conference rooms, the pantries, and the chair count drops dramatically. There's really no way to maintain the density of people. Luckily for everybody, video conferencing had been taking hold quite significantly. So the conferencing component of it, I think, is less impactful right now, but I think the staffing is a big impact. In this example, you're dropping anywhere between 35 and 55% of your staff counts if you're dealing with some of those open office scenarios. That's a big jump, and that's going to have huge implications on the commercial office space.
Now, your office, your firm itself has redesigned. Is that right?
Correct. So we were in the process of redesigning anyway. So we kind of predated it, but we looked at our offices because we have a varied, we have offices, we have workstations, we have, a variety of types of setup. So we wanted to use that as kind of a case study. How does it really change things physically? And
are your employees feeling safe? I mean, is that your view? Or?
I hope they are. We're at about 30% occupancy right now. We've initiated, a self-monitoring program. So as an architect, I installed a touchless thermometer in our office so staff can take their temperatures every day. That's not something I pictured doing 6 months ago. I spent a day putting one-way arrows all over the floor in our office to keep people flowing the right way, to minimize intersections and, surprise meetings with people. We have clients nationally and internationally, so the video conferencing thing was probably the least impactful on our side. But we're a collaborative profession. We like to get together, design charrette, and do all of that. So we've had to readapt how we do that, whether it's digitally or one-on-one with a little bit more space between us. So it's not an easy thing, but I think we're doing it. And the bottom line is you have to make people feel comfortable in order to make it work. The only way it's going to work.
The other diagram you had was regarding restaurants, and we're going to soon hear from John and his restaurant, but can you just take us through this briefly?
Sure. It's a very similar, it's a spatial exercise. How do you start to spread out tables? This particular study is a 5,500 square foot standalone restaurant. This one, it was actually in budgeting and whatnot. So we looked at it and said, okay, how do we take the existing furniture that they have and rearrange it to be socially distant so the owner doesn't have to spend money, because right now restaurants are one of the most hurt industries out there. So here you can see all those little social distancing circles where we spread the tables. Banquettes, we spread the tables along the banquette. It's significant. You know, we're stacking every other booth, so every other booth is unoccupied. There are other ways to deal with it with physical barriers. You're going to see some of those. I thought John was extremely creative in some of his solutions. And it's going to vary on market type. You know, this particular restaurant already had a separate entrance for to-go and pickups. So they had their own carry-out entrance, come and go, never really in the restaurant. I think you're going to see a lot more of that. It also depends on what your market is. You know, if bar sales are significant, you're going to see a shift in how the space around a bar is designed, whether it's the ability to get more people in the bar area or not. So some of it's going to depend on the type of market that you have. And then a lot of it's operational, which we'll talk about later, I think.
Great. It's for me, it's lunchtime, so now I'm hungry and we have a chef on. So now I'm thinking over the menu he just went through us as we were prepping for this. And John Kryn, you also created a video with some help from the good folks in Fairfax. Can you describe that while I try to figure out to run it?
Yeah, absolutely. And again, thank you. I'm honored to be on this panel. I do want to start with a little, one of these things is not like the other observation. The decor on my walls of my office is very different than your guys. And I do offer consulting services if you all want to come my way a little bit. So nice to have an office with a bunch of wine on it. So the video is worked on with the Fairfax County Health Department and Fairfax Forward, talking about best practices of reopening during the pandemic.
Right, and just give me a second, folks. I'm trying to manipulate my ornery computer. And all right, so I am almost there. All right, John, I'm going to play this. About 3 minutes, folks. Actually, it's exactly 3 minutes.
Local businesses across Fairfax County have had to reimagine the way that they do business during this time of COVID-19, from restaurants like this one to retailers to auto stores. Everyone is always concerned. Are they providing the best health and safety practices that they can for their customers and for their staff? Some of those basics include masks and other protective equipment that might be needed depending on your line of work. It includes social distancing. Here at this restaurant, you can see that all of the tables are spread out, and they actually on weekends turn their parking lot into part of the restaurant to ensure that people can spread out and meet those guidelines as well. Hand washing, all of these basic behaviors to make sure people stay safe.
So certainly, you know, in the middle of March when the world changed, I mean, pivot was the first word that came to my mind. You have a small business and you have to continue somehow. Well, as far as, I mean, the requirements are good and stringent and very, very helpful. You know, starting with the social distancing of staff and guests. Masks, gloves, shields for all staff that are interacting with guests. Signs in the bathroom, only one person in at a time. Bathroom attendants, sanitize the bathroom after every use. As a chef and a restaurant owner, you know, I'm used to running a happy place. That's what restaurants are. And it's got to be a happy place for your staff and comfortable for your staff. So since I've been running restaurants for 20-something years, I've always had a policy of, you know, if you're sick, I'll pay you anyway. And that just makes someone comfortable to, you know, before, tell me you're sick, you know, before I have to see it, and not feel like you're going to miss a paycheck.
And now I take the temperature of everyone when they come in. People tell me all the time, like, I feel safe. And it's funny, it's not something a chef ever needed to hear. Food good, that was really nice. Great service, that was great. Now it's a third one, I feel safe.
For more information about Fairfax County, you can go to the Fairfax County website and find information about our COVID-19 emergency response, health information, and business information as well. And then at the state level, Virginia also has a wide variety of resources for its residents as well as its local businesses.
Great, great. So, another great informative video. Appreciate John and the Fairfax County team putting that together. And I was actually, I think it's in Fairfax County, isn't it channel 16 at the local channel? So thank you for doing that. Trust.
Hi, I'm Danielle.
Oh, sorry.
And I'm a scientist here in Fairfax.
Sorry.
When you think of the word scientist,
one second.
is this what you think of? People in lab
That's a
coats
scientist,
looking
and
like-
that's what I think of. One second, folks. Sorry about that. I'm back. We all here? Good. Sorry about that. And there was another Fairfax video. I'm sure Channel 16 was involved. So you talked about trust, faith, confidence, John, in building a rapport with your clients. How's it going? And how do you know that you have that trust and that faith?
Well, I mean, I named the restaurant Clarity for a reason. I mean, it's what we're all looking for in life. It's life and business and personal. It all starts with relationships. So that's a big part of my restaurant from the start. So building those relationships has already gained a lot of trust. And then when, like I said, when the world changed, we have a lot of supportive people wanting to help us stay in business. One of my jobs was immediately to pivot, like I said, and to align my business with the comfort of my staff and guests, right? So there's plenty of support to be had. You just have to align it. So that was that conduit that I had to create, right? In the safety in my practices, because if I do that right, then I do have plenty of support to come keep us in business. The key is alignment.
Is the alignment. And I noted that, and I think I read, it was Washington Post about your restaurant. Early on, you were an early mover in trying to addressing the issue, right? And it struck me as a very business-oriented maneuver where you made outdoor dining more fun, right? And you had your slips, I think it was an analogy to a marina, to take away and dine outdoors. What's been the overall reaction of your guests? Are they at ease? They totally believe that you're on top of it? And does that distinguish you?
Well, I mean, I did want to be a first mover, but not, for any reason except that you really have no time to do anything but be a mover, whether it be first or second. I mean, you have to do something immediately. So I had a good footprint to work with. When back in March, I was already looking at the parking lot for when the weather broke to be able to utilize it. People I feel, when things are, in a sense, visual, anytime you can do it, and packaged. So for example, I saw the parking lot and I saw parking spaces. Parking spaces are painted, they're delineated. They were 9 by 17. There's my social distancing right there. If I use one alternate parking spaces, I have 9 feet between slips or campsites or whatever you want to call them. And then my idea was to package that up to make people feel good, like they're doing something special, even though they're in a parking lot. And that's why I said, well, let's put the table in the parking space. I still have to park the car, even though I'm in the parking lot. So there's room for the car. So I put the car in there too. And then my wife said, well, you better get a tent over that. And I said, okay. And it turned into a nice little packaged campsite. That's a little bit of tailgating and a little bit of eating off the back of your boat. and a little camping. And it worked out very well, and people socially felt good. First of all, the delineated 9 feet of social distancing. Everybody can see that. They don't have to measure it. And then, putting some thought and effort into the packaging of the space really helped also. So the reaction was immediately really, really positive. And then it just kept building on it. I mean, I said, well, if you want to bring your kids, they can set up their own kid cave in the back of the SUV, back it up into the space, give them their iPads and phones, and trust me, they won't care if you take 6 hours to eat. And that really worked too. So then once you have the base idea, I started building on it, and it's just really worked well. And like I said, that was aligning what my guests were looking for in order to support us.
Oh, that's fabulous. And, I could just imagine, what a wonderful distraction for the kids, and you don't have to be, rushing back to relieve the babysitter. What innovations, so you've adapted, Gene took us through some adaptations to restaurant spaces. What kind of innovations have you made, and will you hang on to those post this COVID period?
Well, interestingly enough, it's sort of like everyone accepts in the fashion industry that things go out of style, then they come back into style eventually. And if you keep something long enough, it'll come back in style, and then you'll be cool. We went just like office workplaces, it went from cubes to communal, and apparently now it's going back to cubes. Well, a long time ago, dining tables in open dining rooms were actually, go to some places, the fancier places, were actually delineated and carved off into private tables using curtains or windows or separators. So that was the first thing I thought of to elicit comfort in the dining room was, let's separate the tables. But, plexiglass, didn't really fit the bill. And I don't think, made the restaurant better, either physically or socially. So we hung curtains from the ceiling, and now we have all tables separated. And as soon as people walked in, not only did they feel comfortable, but they said, hey, this looks great. Are you going to keep it? And I'm like, I'm definitely going to keep this. So I think it actually upgraded the restaurant in general.
That's great. That's awesome. I could imagine. I have not yet been to your great restaurant, but that is going to change for sure very soon. Now, for the folks in the audience, I'm going to close that poll in a moment. So if you would please just quickly answer those 5 questions if you have not already. And so we'll go ahead and we'll do that in just a moment. But before we do, we're going to take 1 or 2 questions here. Let's see. So this first question is, what protocols do you promote for using, this is going to probably aim at Chris here. What protocols do you promote for using public transit, and are you promoting the use of public transit? So Chris, may I ask you that?
Sure. Well, it really depends on the individual and their sort of state of health. So obviously, if it's an otherwise healthy person, we want them to, have wear a cloth face covering because they are out in public. They may choose to wear gloves if they're concerned about touching areas that could have the virus. We certainly recommend that once they do reach their destination, that they do wash their hands at the recommended practice of 20 seconds. And again, not to touch their face, especially immediately after they got off the bus or got out of a taxi or or an Uber. We do not recommend for individuals who have symptoms, and certainly for individuals who are either positive COVID cases or are part of our contact investigation, for them to take public transportation. In fact, the recommendation is that they isolate and quarantine themselves, that they not leave their home at all. Now, if they can adequately provide separation and space within their household from other family members or household members, and those individuals don't have symptoms, they can go out and do the shopping and do whatever, daily tasks the quarantined or isolated individual would have to do. But under no circumstances should they be out in the public, and certainly not taking public transportation if they are sick or have been in contact with someone who is sick.
Thanks for that. There's a question here for Jean, which I'm just going to try to find again here. Just a moment, please. Well, let me ask this question. And the question is, there have been a number of stories in the news about inside air circulation, the possibility of spreading virus particles to others. Jean, in your work, have you come across this, and what's the latest?
So there are obviously major concerns, and there are mitigation strategies that they're developing, just as vaccines are being developed now. There's two very simple solutions that are probably the most common. One is increasing the called tightness, missing a word here, the filtration system of mechanical units. So a lot of these fall to the landlord, so you have to check with your individual landlord to see if these are possible. But going to what's called a MERV 13 filter or higher, that increases the filtration capacity, which is obviously a good thing. The second is increasing the ventilation rates. That's basically putting more outside air into the space to keep airflow moving more. Most commercial systems can take those two changes, but you want to check with obviously a mechanical engineer and make sure that it works. Beyond that, there's a lot more of the higher tech systems coming online. There's UVC, which is a type of lighting that can kill it. But those are high dollar systems. They're dangerous to people. They would have to be used off hours. So there's a variety of other things. There's ionization. So there's several other technologies coming online, but I don't think you're going to see them readily in a normal commercial environment. The filtration and the ventilation, I think, are the two primaries that you'll see.
Another one, I'm just going to throw it at Jean here because it's sort of back to back. Are you seeing a growing demand for converting commercial office space to a combination of offices as well as residential apartments and lofts? With respect to COVID, I don't know if that's with respect to COVID, but let's assume it is.
Right. I saw that question. It's an interesting one. I don't think yet you're seeing a reaction in the marketplace that quickly. Mm-hmm. There's certainly the multifamily apartment side of the market is actually booming. I think you're seeing suburban markets creeping up as people kind of get out of the cities where they feel trapped and on top of each other. We've done several kind of live work situations, projects, and they're popular, but again, retail is the biggest question mark in the world today right now, in terms of how retail will plow through this and what the next retail looks like.
I think I was going to switch to the poll results because we were kind of closing in on time here. So let me just rattle these off. And I think the viewers and certainly the panelists, you should be able to see these results as well. I'll just state the question in the first place. How safe do you feel going back to work at your company, office, or place of work? 54% number one answer, somewhat safe, but still pretty worried, was number one answer. Number two answer is, I feel safe. Second question, and gentlemen, please, jump in there if you want to offer a comment or an observation about these. The second question is, which are the most important actions that would help you feel safe returning to work? And the number one, this multiple choice, was masks required in the office. Number two is distanced workstations. That seems to be the thrust of this conversation today in any case.
So it looks like the option to work remotely was.
Oh, I'm sorry. Let me just Oh, I'm sorry. See, that's the problem when you don't read well. Option to work remotely. You're absolutely right. 78% of the respondents chose that response. Again, multiple choice. And number two behind that was masks required in the office. And this goes in tangent, Jean, with your point about either high tech or services companies, their ability to work remotely. Restaurants, they don't have that ability to work remotely, but given the situation. The third question, yes.
I was just going to say, one of the interesting parts about that question is it highlights the fact that you really can't do one or the other of these recommendations. They all work together. And there's got to be a willingness. There's no design strategy that's going to solve everything. Everybody has to be willing to do it. And I think that's what talks to question one. You know, I'm somewhat safe, but I'm still worried. I think people are worried about other people more than they are about the space necessarily. And I think that's the risk out there.
I have a second to touch on something, the air circulation. Interestingly enough, so Clarity is an open kitchen. And that kitchen has a hood. And that hood is connected to a makeup air system because those hoods pull air out of a kitchen, and coincidentally it's open, so it's open to the dining room. That hood is pulling a massive amount of air out of the restaurant into the hood system and out the roof, and it's being replaced with fresh air from the outside with a system called an air handler. Which is a makeup air system, which is it's an air conditioning system the size of half a school bus. Back at the restaurant, it's required. So it constantly, there's fresh air being pumped in and air being pumped out of a restaurant that has an open kitchen environment. Just an observation that I was thinking about the last couple of days.
Yeah, typically assembly spaces have the most outside air requirements, so they're drawing in the most outside air of spaces here.
If you have an open kitchen, then that air from the dining room is actually being pulled right out of the restaurant through the hood.
Hey,
Interesting.
John Jacobs, you know, if I could, just those first two questions and the top answers, you know, I wanted to try and draw a connection between the two of them. Because I think they not only reflect the feelings of business owners, but in many cases, they reflect the workers themselves. You know, there's a lot of fear and, you know, for workers in our community that if they can't work, they're going to lose their jobs. And certainly when you're working paycheck to paycheck, as many people in hospitality and retail find themselves, you know, they don't have the option to work remotely, as John Krim pointed out. So, you know, I think the important takeaway, and I've watched the two videos a number of times now, and my key takeaway from them is that their employers are showing compassion and empathy for their employees. They're understanding and addressing that fear and that anxiety. They're creating as safe possible workplaces as they can. In the case of John Krim, he's gone the extra step of paying his employees if they're out sick or have to quarantine for 14 days. And that's really important because you have to address your employees' feelings. I know it's about making your customers comfortable, making them feel safe, and obviously want them to return. But if you don't create that compassionate, caring, and safe workplace, you're not going to have workers who are going to be able to provide that service to your customers. And from the health department's standpoint, if we're asking an individual to have to stay in their homes for up to 14 days, knowing that's going to be a very stressful and maybe economically infeasible time for them, in many cases, if they're not getting the support from their employers, they're simply not going to comply with us asking them to stay home. They're going to go into work. They're going to go out into the community. And that's frankly the worst thing that can happen because that's going to really hurt us in terms of being able to contain and box in the spread of this disease. So I want everyone who's listening in on this to understand that, you know, your employees are a very important part of this equation, and compassion and empathy are two of the most important things that you can provide to them. And again, in these very uncertain times.
Well said. That was well said, Chris. And I want to just go through the poll just to, this time I'll learn how to read it correctly. But, you know, this third question is kind of aimed at John Krim. Is would you dine at an indoor restaurant in the next 2 weeks? 64% of the respondents said no. And John, you've gone a long way to build that trust, to create the environment. And let me ask you this, is it taking time? Is it a ramp and word of mouth that, clarity is a safe, first off, great food. Second off, a safe place to eat. Does it take a long time to ramp that?
Well, in my case, like I said, we have a lot of support, and I keep in close communication with many of my guests, and they keep tracking me social media, so they know what I'm doing. I've been telling the story all the way since March. So getting the word out, has been pretty rapid. But I can't tell you how many people that come in are saying every single night that it's my first time out in 5 months. And this is the first place they're going. So obviously that is a major priority.
Yes. Yeah. The question for which type of environments were you the most? Big answer on bars. We've heard a lot about bars in the south east of the part of the country, out west. No surprise there. We've covered restaurants. Offices, to me, not surprising, is down in sort of the third, fourth position, and open air parks, nominally a concern, it seems. Fifth question, final question, when do you think you will feel safe returning to normal activities? And the number one answer here, not until a vaccine is available. And number two answer, 6 months or more. So a pretty alert, concerned populace, which frankly, it would seem to be the best approach to this scenario. And Chris, you mentioned about building the trust, creating the environment, and having that empathy, putting yourself in the shoes of others. It's and Jane, your point is a composite answer, right? It's not one item; it's 7 or 8 things that have to be done. There was one request to see the URLs again that we had provided in Chris's section. So if everybody just give me a moment, I'm going to go do that. And yes, you can see my wonderful skills here again. Right, here we are. So CDC, the Virginia Department of Health, Fairfax County. I'm not going to read the URLs because it's a lot of words. So there you are. There's that slide. We're really running up close to time here. Any final thoughts from the panel on getting through this? I mean, optimism seems important to me. Any thoughts?
I mean, to me, there's no right answer. It's evolving every day. I think you're going to see these changes slowly roll. I think the next 6 months is going to be a huge change in how I do my business. I would assume how John does his business and what the landscape looks like.
Restaurants are like a little staycation for people. I mean, I've been, just privileged to actually be sort of something that people are looking forward to in the community because of the situation they've been in. So it's been, ultra important to provide a safe, happy environment so people can come out and look forward to something. Since there's no traveling, I mean, it's coming to clarity instead of taking a trip to Italy. So high expectations, actually. But that's something that I'm keeping in my head 24/7. The opportunity and the privilege that I have to be able to do this, and you really have to make an environment that welcomes people in a safe manner.
I guess my closing thought would be that, we've come a long way from the peak of the outbreak in our region since May, but we can't let our guard down. We're several months away from a vaccine being approved and distributed into our community. And we've seen what the impact can be as communities begin to reopen. There's a consequence to people being casual and thinking that they can just go out and live a quote unquote normal life again and not pay attention to protecting themselves and others around them. And I'm certainly not suggesting that we're headed in the direction of what we're seeing in other parts of the country and parts of the world. But we have to acknowledge that COVID-19 is still very present in our community and will be for quite some time. So we have to be ever vigilant, and we need to be patient and understanding and empathetic of one another. Nobody is perfect. Nobody is going to wear their mask appropriately all the time or at the right time. But just by gently correcting behavior, it can go a long way.
If I could just add one more thing, I mean, lots of states and countries or counties are reacting and acting like this to this in a different manner. Northern Virginia, the empathy and the action and the collaboration, such as webinars like this, between the entities and the business owners has been absolutely fantastic and has warmed my heart. To have so many people part of the solution, and I very, very much appreciate it. So thank you. Thank you.
And thank you to all of our panelists. We are out of time. I'm just going to go back here. Just a quick housekeeping item, if I may. Right. This is the 8th in our series. We have, I can do the math, 9, 10, 11, 12, 4 more to go. And we'll run every other week all the way to the middle of September. I want to thank the panel. I want to thank our guests for being here. This has been a really important discussion and an impactful one. Next webinar will be Thursday, the 6th of August, 2 p.m. Eastern. IT, cost or investment is the question. And all of these webinars can be found on the novaeda.org website. So this is the compendium of. And so you can go there. It's under novaeda.org under the events tab. And then you can just register. It takes 2 seconds and watch all these videos. And thank you to the panel. Thank you to the audience. I look forward to seeing everybody in a couple of weeks. Take care.
Thank you very much.
Thank you.
Thanks, everybody.